Welcome to Fight Cancer Global's informational video series. Our aim is to empower individuals with knowledge and resources to combat cancer. Today's video will explore how chemotherapy is used to treat leukemia and its effectiveness, offering valuable insights and actionable steps to aid you and your family in the fight against cancer. Chemotherapy is a standard treatment for many forms of leukemia. It involves the use of powerful drugs designed to kill cancer cells or stop them from dividing. The goal is to eliminate all the cancer cells in the body and induce a remission. Different types of leukemia require different chemotherapy regimens. In acute leukemias, such as acute lymphoblastic leukemia, ALL, and acute myeloid leukemia, AML, chemotherapy is often intensive and given in several phases, including an induction phase to destroy most leukemia cells, and a consolidation or intensification phase to kill any remaining cells. In chronic leukemias, such as chronic lymphocytic leukemia, CLL, and chronic myeloid leukemia, CML, chemotherapy may be used, although other targeted therapies are also commonly employed. Treatment is typically less intensive than in acute leukemias, with the goal of controlling the disease over the long term. The effectiveness of chemotherapy largely depends on the type and stage of leukemia, as well as the specific chemotherapy regimen used. For example, All in Children has a high cure rate, with about 90% of children achieving a long-term remission with appropriate chemotherapy. Chemotherapy is typically administered in cycles, with periods of treatment followed by recovery periods. The total duration of treatment can range from a few months to a few years, depending on the type of leukemia and the specific treatment plan. While chemotherapy can be very effective, it also has significant side effects because it targets all rapidly dividing cells, not just cancer cells. These can include fatigue, nausea, hair loss, and a high risk of infections due to the impact on the immune system. To mitigate these side effects, other treatments are often used in conjunction with chemotherapy. These might include medications to manage nausea, growth factors to stimulate the production of healthy blood cells, and antibiotics to prevent or treat infections. Despite its side effects, chemotherapy plays a crucial role in treating many leukemias. It can be curative in some cases, and in others, it can help to control the disease and improve the quality of life for those living with leukemia. Emerging treatments such as targeted therapies and immunotherapies are also showing promise in treating various types of leukemia, sometimes in combination with chemotherapy, bringing new hope to those affected by this disease. In summary, chemotherapy is a widely used and often effective treatment for many types of leukemia, despite its significant side effects. The exact regimen and its effectiveness depend on the type and stage of leukemia, among other factors. Future advances may offer even more effective treatment combinations, increasing the chances of survival and improving quality of life. Thank you for viewing this informational video brought to you by Fight Cancer Global. For additional content and support, you can visit our website at www.fightcancerglobal.org, where you will discover a great many resources as well as a supportive community that knows your cancer journey. Let us join forces and make a meaningful impact in the fight against cancer.